heart health, you have to do an aerobic moderate intensity exercise. We can talk about 4. Hello everyone, I'm Dr. Mohamed Mesbah Taha, Interventional Cardiologist Specialist. I'm working in NMC Medical Center Sharqan, Sharjah, and my specialty is dealing with atherosclerosis, hypertension, elevated blood pressure, heart diseases, congenital heart diseases, coronary heart diseases, heart attacks. Today we are going to talk about a very important topic. It's the heart attacks. I'll give you a brief around how to deal with it and how to prevent it, and I think it will be an educative, short, fruitful session. Basically, heart attacks mean interruption of the blood flow to the heart, either complete interruption or blockage or incomplete. So both have different scenarios, and we're going to give you more notes regarding that. Regarding preventing the heart attacks, which is most important, we have to know that your lifestyle is the best weapon against that. First of them, we have to talk about that you have to stop smoking if you are a smoker, either positive smoking or negative smoking. After that, we have to talk about the diet. Your food habits are the most important thing, as it helps you to prevent the risk factors that leads to these heart attacks. We have to limit the use of the trans fats, the high food in salts and the processed meats, and the high calorie intake. You have to avoid that. You have to stay away from the fried food, go more for the grilled food, fresh vegetables, fresh fruits, legumes, whole grain food. All these you have to do to follow a healthy diet plan. And also you have to think about your weight. Your weight should not exceed the accepted for that. You have to keep the balance of your weight and to stay in a caloric deficit, a very minimum time to do that. Also, you have to focus more and more on your physical activity. You have to be more active, and you have to do an exercise, especially the exercises that you should keeps you fit, as aerobic exercises. You have to do a moderate intensity of these exercises day and day. Regarding, we have to talk more about the blood cholesterol level. You should keep it low through the food habits as we talked, and also through that if you have the genes of these high blood cholesterol, you have to check of your lipid profile and follow as regard. Other things in the lifestyle that you have also be more concerned about, we will talk about the stress. You have to stay away from the stress as much as you can, of course, and you have to have a good sleep quality. You have to sleep at night every day, every night we can talk about 7 to 9 hours and in non-interrupted sleep. And to do that, you have to follow a routine, a bedtime routine for that, and to stay away from also the electronic devices while you are trying to go to bed. You have to do that every day, every night. Regarding the alcohol, you have to limit the alcohol consumption. If you don't drink, do not start. And if you drink, you have to limit it as much as you can. These are most important things regarding the lifestyle that you should follow to avoid as much as you can the heart attacks. Okay, regarding the exercises for better heart health, you have to do an aerobic moderate intensity exercise. We can talk about 4 to 5 times per week. Every session will be 30 minutes to 45 minutes, such as jogging, spinning, swimming. And if we are going to talk about the weightlifting, this is of not much importance to the heart. But it's okay if you do it without taking more supplements as much as you can. The heart attacks can come sudden and severe, and can come also mild, but it can give you some warning signs before it came. So you should be aware of these warning signs, and if you got one of them, you have to seek the medical service immediately. These warning signs should be the chest discomfort. This is the first and the most important one. It doesn't have to be a chest pain. It might be a chest discomfort over your whole chest, not to a simple point. And this pain should be like squeezing or heaviness or crushing, and it may refer to your arm, your neck, to every part of that. What else other than the chest discomfort? The shortness of breath, difficulty in breathing, especially when it comes when you do an ordinary effort that you do without any symptoms before. So it's an important one. Also the palpitation. If you have the awareness of your heartbeats more than usual, either rapid heartbeats or slow, regular, or even irregular or interrupted heartbeats. Also the easy fatigability. When you feel fatigue more than easy than usual, you have to think about it also. Regarding also another less common symptoms and signs for these heart attacks, the unexplained heartburn and nausea. If you feel nausea without any GIT or gastric problems, so you should think about it. Also the jaw pain. If you have a pain here, unexplained, related also to the chest discomfort, you have to be more and more aware about that. It might be a warning sign of the heart attacks, and these mostly are the most important alarming signs and symptoms of the heart attacks. If you feel these warning signs or one of them, you have to seek the medical service immediately, and you have to call the ambulance, rest. If you're not allergic to the aspirin, you have to take 325 milligram of aspirin. You have to chew it firstly and then swallow it. And rest, sit your back, take a deep breath, slow breath, and wait for the ambulance. And when the guys came to take you to the medical service, you have to talk with them about your medical history, your family history regarding that, if you know of them, and keep the rest to us. Okay, finally, the take-home message